Hello, my name is Zoe George and welcome to our scar therapy massage video. So in our video today, I want to take you through some techniques that you can do at home to manage your scar tissue. So when I'm in clinic and working with patients, I do like to teach them techniques that they can do at home. And I have seen this can make a massive difference in managing their scar tissue moving forwards. If you can do this on a regular basis, daily if you can, you'll see a massive improvement in how your scars feel. Now you can see today I've created some scars on myself to show you some of the techniques. Now, one of the things if you've had radiotherapy is that can make the layers of soft tissue stick together. So when I'm doing massage, I work on the whole of the area and then look at focusing in on the specific scars. So you can see what I've done here on my t-shirt is I've created a mastectomy scar. I've also created some lumpectomy scars and also a scar in my armpit for node removal. So if we start here with the mastectomy scar, in most cases it's a straight scar going all the way across the chest and maybe up in towards the armpit. Some people might have a little dog ear here as well, and it really depends on how the surgery was performed, but in most cases this is what we might find. Now, with a mastectomy scar, flat mastectomy scar, I also find that patients are very tight around their rib cage. So in terms of starting at the top, think about, imagine you're trying to knead bread with your fingertips with one or both hands, making little circles digging into the skin. Now I'm not using any medium here, so no cream or oil, just your fingers on your skin. Working in little circles, but if I go a little closer, you can see I'm actually digging the fingers into the skin and letting go. We need to lift the tissue up and then let it go. So here creating circles, working all the way across the chest. Many patients find they're very tight around their sternum area here as well. So make sure you work into the sternum, working all the way over the chest. And as I said, even right down into the rib cage. You can also use this technique all the way up into the armpit as well. Once you have released off that whole area on the chest, then we can actually work on the physical scar itself. And again, working in that scar with one or two fingers, softening that tissue off and working all the way along the scar, as you can see. Once that scar is nice and warm, another technique you can do is what I call pin and drag. So you hold one end of the scar with your finger, and with the other finger, you gently drag along the scar, let go. Drag along the scar, let go. And you move all the way along your scar with your finger. Okay, then you can go back again to manipulating that tissue and softening that tissue off. Coming to our lumpectomy scars, some patients are perhaps cut around the nipple, underneath the breast. You might find you've just got a single scar at the side if the removal, the lumpectomy was the side of the breast. And it's the same technique as on a mastectomy scar. So again, we start by releasing off the whole of the breast, especially if you've had radiotherapy. Okay, so doing those lovely circles, one or both hands, working in, digging those fingers in. Imagine you're kneading bread with those fingers and work on the whole of the breast. Then you can come to the scar itself and you can gently manipulate and work along the scar. Now you might find there's some tender bits in there. You also might find that it feels a bit lumpy. Don't worry about this. Scar tissue does feel a little bit lumpy, but the more you manipulate that tissue, the more softer it comes. Also with radiotherapy, I do find this with quite a few patients, is that sometimes underneath the breast here, the breast can go quite hard underneath, okay? Again, with manipulation, that will soften off and become a lot more comfortable for you. Again, what you can do is the pin and stretch or pin and drag, working all the way along your scars, maybe gently around the nipple, working along the scars. Now those scars in the armpit, these can cause quite a few problems. We haven't got a lot of soft tissue in the armpit. They can become quite stuck. So again, with your fingers gently in your armpit, sometimes the armpit can go quite hard as well, is working into that armpit, all around that scar area, releasing that tissue off nicely. Okay. And again, you can work on the actual scar itself, manipulating the scar. Some women find, in particular with this kind of surgery, that their pec muscle, this is here at the front here, this can also go quite hard, and this can affect the movement of the shoulder. So also I find it's a good idea to work in the front of that pec muscle here, releasing that off. Just like so. The other thing as well is making sure we're doing regular stretches of our shoulder and our tissue. Where the radiotherapy makes the soft tissue stick together, what should happen is when we lift our arm, is all that tissue should slide with us, and with the radiotherapy it gets stuck. So when we lift our arm, we are pulling against that stuck tissue. So the more movement we can gain in that tissue, the better. Simple exercises like elbow circles, stretching that arm up, stretching over to the side, opening through the chest, getting the shoulders down. So if you're regularly massaging your tissue, you get to know the tissue better yourself. You understand where the lumps and bumps in the scar tissue are, which I think is very useful when you're doing your self-checks. But also that regular manipulation of the tissue will make the tissue feel a lot more comfortable, make you feel a lot more comfortable. So I hope you found today's video useful. Thank you so much for listening.